Mr. Earl Johnson, it's Chelsea. I'm a student nurse, and I'm here to give you your morphine and your cephalexin. And so this is my second med check. I've pulled the morphine and the cephalexin. And so, Mr. Johnson, are you having pain right now?
Yeah, I am. I'm in a lot of pain.
Okay, and what would you say your number for the pain is?
I'm still at like a 6 or a 7. It just really hurts.
Okay, I'll get working on that and try to get that taken care of for you. The morphine should help, okay? Okay, so this is Mr. Johnson again. Can you verify your name and birth date for me?
Yeah, it's Earl Johnson, 12/12/38.
Okay, Earl Johnson, 12/12/38. That's perfect, thank you. All right, so I have morphine sulfate, and this is 2 milligrams per 1 milliliter, and I need to give 2 milligrams per IV, and that's due now. It's 10 o'clock. This is the right time. This is the right patient. This is the right medication. This is needed for moderate to severe pain. He has a level 6 to 7 pain, and it is not expired. It's 6/25, so this is still good. And so that is due now. And oh, Mr. Johnson, do you have any allergies to any medications?
I don't.
Okay, good. That's what I have here, no allergies. And the cephalexin, which is the antibiotic, is due now. This is 1 gram, so this is the right medication. The bag looks to be intact, and it's not discolored, so this is good. It's due now at 10 o'clock. And this is 50 milliliters, that's correct. And this is, both medications are okay to be given with the saline that we have, regular saline, and they're both due now. And it's to be administered over 30 minutes for the first dose. All right, so when I set the machine, I will have it for 100 milliliters, or 100 milliliters for 50 milliliters for the half an hour time. All right, so I'm gonna go ahead and prepare the medication. And the morphine is compatible with the saline. Check on that. I did hand sanitizing when I first walked in. I'm going to redo it just to make sure. There we go. For my flush for later. Okay, so I'm gonna go ahead and prepare the morphine. Actually, I'll take the top off first. And this needs to be clean for 15 seconds. So it will be clean for 15 seconds. And then it needs to dry. And while it's drying, I will prepare my needle to get the morphine. So I'll seat this. Okay. And this is for 1 milliliter. So I pull back the air. I'm going to push the air in. And I need to drop back 1 milliliter. Trying to be careful to not have any air bubbles. I'm going to get my air bubbles out. Okay. There we go. So I need to waste the rest of this medicine, so I'm going to get my another nurse in here and let her know and show her the 1 milliliters. So I have 1 milliliter and I'm wasting the morphine.
Sounds good.
Okay. All right, so that's going to be wasted. And then I need to, I'm going to inject this into my So, okay, injected the medicine into my thing, and I need to put this in my sharps container right over here. All right, I want to make sure all the air bubbles are out. So, okay. Oh, and I also need to label this. This is my morphine, sulfate, and this is expiration 6/25, and this is at 2 milligrams per 1 milliliter, and I'm giving 1 milliliter because there's 2 grams due right now. This is gonna go there. All right. Now, Mr. Johnson, I'm gonna go ahead and, I need to put gloves on. I wish I wouldn't have thrown away the lid. So I wouldn't have normally thrown away the lid. So I gotta put that on there. Now I feel like I'm gonna lose it. So but I did throw away the lid, so that was something I shouldn't have done. Okay. So, Mr. Johnson, I'm gonna go ahead and pause this. Where is it? It's already paused. It looks like. Okay, so I'm gonna just go ahead and check your IV site. It looks good. Is there any pain or how's it feeling?
Feels fine.
Okay, good. It's not red, it's not swollen, so there's no infiltration. It looks like it's supposed to at this time. So now we're gonna go ahead and this one's the medication. And oh, here we go. Okay, how's the machine? All right, so I need to clean the port before I administer the medication. Oh, I'm gonna do my 3rd med check one more time. Here at the bedside, I have the morphine. You are Mr. Earl Johnson. You've identified yourself already for me. This is 1 gram, or no, this is 2 milligrams, so this is 1 milliliter, and it's needed right now. I'll be providing you that right now. I'm gonna go ahead and clean the port. It's 15 seconds that I'll clean it, and then it needs to dry. Okay, and then go ahead and twist that on. So I would have taken off the lid because I would put the lid back on, but I threw it away. So that was my mistake. So now I'm gonna push this over 5 minutes. So this would take 5 minutes to go in. All right, so I administer the medication over that time. And then, so it's a slow push. And then I can take that out now. I'm going to administer the saline here, just make sure it's administer some more saline to flush it. And then that will give So that morphine should help you, with that pain. Mr. Johnson, have you had morphine before?
Yeah, I think so.
Okay, I'm sorry. So if you feel any, I should have asked that ahead of time. If you feel any itching or you start to feel dizzy or have any nausea or discomfort, please let me know, okay?
Okay, sounds good.
Okay. So now I'm going to do this with a little Traxin. And so I've wasted that medicine. So again, I've checked my bag, and this is the right medication, and it's intact, and it's not expired. It says 12:30, and this is for the right patient at the right time. So I'm gonna go ahead and hang this bag. Put the lock in place. Okay, get that full. All right. I'm gonna let this prime here. Be slow with it. Okay, there we go. All right, there's that. And I need to lower this. Put my piggy back here. Okay, and now I need to clean this port. And this has to be cleaned for 15 seconds. And then I want it to dry. And then once it's dried, I can go ahead and I can put this in there. Okay, so now I'm going to start my secondary. And this is going to be a 6 set over 100 milliliters per hour. Okay, for 15 milliliters. Now I can push start. All right, so I need to make sure that this is dripping. Okay, so now it's going. All right, so if you have any, if you start hearing this beeping, just let me know. You have your call light, and I will be back to check on you in about half an hour to see how you're feeling with that pain medication that I gave you, and also to check on the IV, because the IV should be done by that time, and that will be good. So now I'm going to go ahead, or do you have any questions for me?
No, that's great, thank you.
Okay, great, thank you. I'm going to go ahead and do my documentation. So I gave the Traxin at 10 o'clock, so I need to sign my name and the morphine at 10 o'clock. And I am, all right. All right, gonna hide this.